So, hip flexors. We're going to address hip flexor tightness and hip impingement. For those of you who pull sumo, might tend to get these kind of hip pains, or for the rest of you that I have on really high frequency squatting, tend to get hip impingement or some kind of pinching in here, or a general pain, whether it be in your TFL, your rec fem, or even your psoas. And the psoas is the worst of them. It's a pain in the butt, and that's honestly what's caused maybe 80% of my injuries and nagging problems. So let's learn how to clear that out. Cool. So the first thing we're going to do is the couch stretch, which is, you've seen it a million times. You anchor your foot on something, or it could just be on the ground, and you just kind of lean into it. But that's not actually how you do the couch stretch appropriately. Most people kind of hyperextend their back. They're hyperextending, thinking they're getting their hip flexors. And the problem with that is that the psoas actually attaches to your lumbar vertebrae, crosses pretty much through your body into the front of your hip. And if you're here, hyperextended, it's still short. You're not lengthening it. Plus, you're just going to cause yourself disc problems. So, what we do instead with the couch stretch is we stand tall and erect like we're going to squat, and we push our hips forward and under like this. One more time, forward and under, forward and under. And you should feel a stretch right there, and then you kind of lean forward just a hair. You only need a small amount. And you can also reach over this way, again, keeping yourself pretty neutral. Reach over. You can also twist in either direction. I like to twist out this way. It helps get the psoas, because the psoas also has a small part in hip external rotation. So if we internally rotate, then it's going to get it a little more stretched. So yeah, that's the first one. You're going to hold it for 2 minutes, both sides. Oh, I can already feel that. Oh, one more thing. In the couch stretch, if you're trying to get your TFL, which is also another pain in the balls, take a ball, lacrosse ball, kind of roll it around in there, get all that gunky stuff cleared out, and then when you go into your couch stretch, your proper couch stretch, hips forward, and then TFL, boom. So again, normal, you want your TFL, boom. You kind of drop your hip to the side, and you're going to feel stretch more on the outside. You might feel it in your knee, but that's just because your IT band is attached to your TFL, and that's okay for now, but you don't want pulling when you're squatting or deadlifting or really doing anything else. So that's 1 and 2 for TFL. Another stretch I like to do that I think I might have made up, but I'm not entirely sure, is we're going to call it the half swastika couch maneuver. So yeah, push you over here, angle this correctly. Sure, why not? Right there. So what you're going to do is you're going to sit on your foot, if not, have it out a little bit, and you're going to lean back, trying not to hyperextend, and then you're going to kind of dump yourself to the side and sit in there. So not everyone's going to have enough flexibility in their hips to just dump right into it. So let me actually show you this side so you can see more. Again, you take your foot, pull it back, sit on it. It can kind of be outside. You're going to lean back. Oh, actually, this one's really tight. This is perfect timing for me. So you're going to sit back. Notice how my back is hyperextended. Like we just mentioned, we shouldn't be. So what we're going to do is we take this leg, the one that's not being stretched, bring it up to about 90 degrees and drop it. And then we're going to roll into it, hips forward, tuck your butt, and we're going to hold this for 2 minutes. You can hunt around, find what you need. If it's a little more psoasy, you can kind of dump your hips in, reach forward more, and you can use these hands to post out and push yourself deeper into the stretch. Again, keeping your hips forward. Don't be afraid to crunch. We want to keep a neutral back so we can get that psoas, that pain in the psoas. Also, if you want to hit your TFL again, you can take this foot right here, place it on your leg, and kind of just push your leg down. Again, it's like a hip dump. But now that you're on the ground, you have more freedom to go forward, go back, rotate into it, which is my favorite for the psoas. You can also kind of just stay here, get a little more rotation, get some QL in there, some iliocostalis erector stretches. Again, hold it for 2 minutes. Hunt around. I haven't perfected this one quite yet, but give it a shot. And if you have any feedback, anything you noticed, or think could be improved, let me know.